Hello everyone, welcome to my YouTube channel SGKmistry Lectures. In this video, I'll be explaining about industrial organic chemistry and in specific, I'll be talking about drugs. So we'll be explaining about chemotherapy, classification of drugs, synthesis of paracetamol and synthesis of sulfanilamide. So these are the various topics which I'll be covering in our today's video. So let us start with understanding more about drugs. So firstly, let us try to understand what is meant by chemotherapy. So now, when we are talking about drugs, okay, or what we call in simple language, the medicines what we take. So these are the chemical compounds which are used for the treatment of diseases and which are used to reduce the suffering from pain. And whenever we are talking about the treatment of diseases or infections in common when we are talking about, so here specific drugs are used to destroy the microorganisms which will cause this infection. Okay, and these harmful microorganisms are also called as pathogens. Okay, so please note this. So they are also called as pathogens. So what do these drugs do? These chemical compounds, which are also called as drugs, they will destroy only the microorganisms or the pathogens that are causing the infection, but they do not cause any harm or they do not affect the cells of the body. So this particular process or the treatment of diseases by making use of these drugs is called as chemotherapy. So now let us talk about classification of drugs. So first class of compounds, first class of drugs, what we are considering is the drugs which are used for the treatment of diseases which are not caused due to infection. So now there are certain diseases which are not caused by the infection by microorganisms or by pathogens. There are certain diseases which are caused by different various other reasons. So the drug that selectively relieves the pain by acting on the central nervous system without altering the consciousness. So these drugs, they only aim on the CNS or the central nervous system in order to reduce the pain. So these drugs are called as analgesics. So this is the first class of drugs which we are going to understand. So examples for these drugs are aspirin, paracetamol, diclofenac, ibuprofen, and morphine. So these are the different examples of analgesics. So these are mainly the painkillers that are used in order to reduce the pain or to relieve the person from the pain. Okay, so here mainly the treatment is not done. Okay, the cause, whatever is the pain, it is caused by certain other infection, right? The infection is not treated, but only the pain is reduced by these analgesics. So that is the main concept about analgesics. Now talking about antipyretics. So this is the second class of compounds. So antipyretics, when I'm talking about pyretics, so something related with temperature. So this is how you can remember what is the role of these antipyretics. So these drugs, mainly the function is they reduce the body temperature during fever, but they do not lower the normal body temperature. So they do not go on reducing the body temperature. They only reduce the body temperature when the person is suffering from fever or there is fever or there is higher temperature than the normal body temperature. So it brings back the temperature of the body to the normal body temperature. So example, paracetamol and aspirin. So these are the commonly used drugs, right, in our daily lives. Next, talking about anesthetic drugs. So again, anesthesia. So you might have already known what, just by looking at the name itself, I hope by now you know what is the role of these drugs, right? So these are the drugs which act on the central nervous system again, okay? And here they result in the loss of consciousness because we know that mainly anesthesia is given to remove the consciousness of the person, especially during the surgery, right? And especially the main aim of these drugs are, okay, how they act on the person, the person who is taking the anesthetic drugs. Mainly the loss of sensitivity of pain is the main reason of using these drugs, so that during the surgery the person is not going to experience any pain. So example for anesthetic drugs, we have chloroform, that is the general anesthetic, and methyl and ethyl chlorides, which are used as local anesthetics, that is only for a particular part. Next, talking about tranquilizers and hypnotics. So these are the drugs. Again, from the name itself, it is very clear. Hypnotics, tranquilizers, right? So these are the drugs which are used to reduce the anxiety. So mainly anxiety, the restlessness, and it will induce the sleep in the person by taking up these particular drugs. And again, these are the drugs which act on the central nervous system. So example, we have barbituric acid and the derivatives like luminol, seconal, equinol, etc. Next, talking about narcotics. Again, I hope you have heard about these type of drugs. So again, these are the drugs which act on central nervous system and they will induce sleep in the person. So again, these are also sedatives. Example for such drugs, bromiton, bromvaliton, sulfonal, and veronal, etc. Next type of drugs, again, these are the drugs which are going to act on the person, okay, the person who is taking up these drugs, and they are not the drugs which are used for treating infections, okay? Other than infections, these drugs are used. These are the drugs coming to that class of compounds. So these are the drugs which are used to prevent epileptic fits. So when you're talking about anticonvulsants, so convulsions are nothing but we are talking about these fits. The person who is suffering from fits, he will be experiencing these convulsions. So mainly these anticonvulsants are used to prevent the fits in the person and also to control the convulsions which are caused by these seizures. So example, we have mesentoin, phenobarbital, primidone, etc. So next talking about cardiovascular drugs. So again, this is also the diseases related with the cardiovascular system or the heart. Okay, it is not because of any infection. Okay, so here we have, again, there are various reasons that are causing this particular problem. So these drugs, the cardiovascular drugs, from the name itself, it is very clear. These are the drugs which are used to treat the circulatory disorders. So mainly the role of these drugs is they either dilate or contract the blood vessels. So mainly the cardiovascular diseases are related with that of the blood vessels, right? There may be blockage or there may be some other related symptoms that are there which will cause the cardiovascular diseases. So mainly these drugs act upon the blood vessels of the heart either by contracting them or by dilating them. So example for such drugs, amyl nitrate, glyceryl nitrate, lactazole, etc. Next, talking about diuretics. Again, from the name itself, it is very clear, uretics. So something related with that of the kidney or the excretory system. So these are the drugs which act on the renal tubules of the kidney and they induce the loss of fluid from the body, resulting in the increased urine flow so that the toxic materials are removed from the body. So example, we have caffeine, theobromine, theophylline, etc. Next class of compounds are the drugs which are used for the treatment of diseases which are caused due to infection. So when we are talking about infection, it is mainly due to the microorganisms or the pathogens which are causing these infections. Okay, so chemical substances which are produced by microorganisms which suppresses the growth or they kill the other microorganisms which are causing the infections. So mainly we know that when these drugs, when we are using these drugs, especially for the treating of infections by other microorganisms. Mainly these chemical substances are also made from the microorganisms so that they can aim or kill the other microorganisms that are there in the patient's body. So examples, we have penicillin, chloramphenicol, tetracycline, etc. So let us talk about the various classes that are there under this antiseptics. So again, from the name itself, we know that whenever we have a wound, or an open wound or cuts or whatever it is, we use antiseptic so that there is no growth of microorganisms in the open area. Right. So these are the substances which prevent the growth of microorganisms or by inhibiting the activity of the microorganisms by completely killing them or by completely stopping their activity. Okay. So example, chloroxylenol, N-hexyl resorcinol, salol, iodoform, tincture of iodine, etc. So these are the various antiseptics that we use. I hope the tincture of iodine is a very common one, which we are very familiar with. Next, coming on to anti-malarial drugs. So again, from the name itself, it is very clear. It is related to the malarial disease, where these type of drugs, these drugs are used to inhibit or for the treatment, inhibit the growth of these parasites which are causing the malaria or for the treatment of malaria. Okay, so these are the drugs used in the treatment of malaria. So we have example of quinine or quinine, whatever you can tell it as, chloroquine, plasmoquine, paludrine, etc. Next topic, talking about antibacterial drugs. So again, from the name itself, it is very clear. Anti is something against. So bacterial. So these drugs act against the bacterial infections. Okay. So these drugs are used to treat diseases which are caused by bacterial infections. So we have examples: sulfonamide, sulfathiazole, sulfapyridine, sulfaguanidine, etc. Next is anti-helminthic drugs. So helminths is the class of worms which are there. Okay. So anti-helminthic drugs are the ones which act against these worms, okay, or the parasites which are there. So these are the drugs used to destroy parasitic worms or to remove them completely. So we have embelin, thymol, tetraxan, etc. So you can see these ascaris, okay, which is there here. Okay, which will again, these are the ones which are responsible for various infections. Okay, so these are the drugs which are used for the treatment of diseases which are caused by these class of worms. Next, we have next class of drugs, that is anti-leprotic drugs. So again, from the name itself, it is very clear, leprotic. So these are the drugs which are used to cure leprosy. So example, dapsone, isoniazid, etc. Next is anti-tubercular drugs. So again, from the name itself, it is much more clear that these are the drugs which are used to cure tuberculosis. So it is very clear from the name itself. So example, we have dapsone, isoniazid, para-amino-salicylic acid, etc. Next, we have anti-amoebic drugs. So amoeba especially, it will cause this dysentery in the humans whenever whenever the water is consumed, which is contaminated by amoeba. So these are the drugs which are used to treat a dysentery. So dysentery, whatever the dysentery is caused in the human beings, in the patients due to this amoebic infections. So anti-amoebic drugs are used to cure this or treat this. Okay, so example, we have emetine, Vioform, diiodoquine, chloroquine, etc. Next, we are talking, so this was about classification of drugs based on whether the drugs are used to cure diseases which are caused due to infection or the diseases which are caused not due to infection. Okay, so next, talking about the synthesis of two drugs we'll be talking about. So first one, we are talking about synthesis of paracetamol. So I hope all of you are very familiar with the paracetamol drug that we use. So it is nothing but 4-hydroxyacetanilyl. So this is the chemical name of this paracetamol. So how do you prepare this? So for this, first we are going to take phenol. So first, phenol is treated with the nitrating mixture. So I hope you know that the nitric acid and sulfuric acid, when you're using this, it is resulting in the nitration of the substrate. So we have phenol here. So because of nitration, because of using the nitrating mixture, there is para substitution of the nitro group. Okay, of course, there may be other products, the minor products, but we are only interested in the para substituent because finally we are interested in forming the para-hydroxyacetanilyl as the product. So we have para-nitrophenol as the first product. I mean, in the first step. Next, what you're going to do is you're going to use iron in the presence of HCl, which will result in reduction. So here, it will result in the reduction of the nitro group. So reduction is nothing but removal of oxygen and addition of hydrogen. So you can define it in either of these ways. So here, the oxygen atoms are removed and it is reduced. The NO2 group is reduced to NH2 group, the amino group. So para-nitrophenol is converted to para-aminophenol. Okay, because of reduction. Now, final step. Now, what happens here? Finally, we want para-hydroxyacetanilyl. Right. So already we have hydroxy group, but we do not have the acetanilide group. We have only the amino group. We want acetanilide, that is, we want the H of this amino group, one of the hydrogen of this amino group, to be substituted by acetate group. Acetate group is nothing but COCH3. This is the acetate group or the acetyl group. Now, this one of this hydrogen has to be replaced by acetyl group. So, you're going to use the acetic anhydride. Okay, this is the acetic anhydride in the presence of acetic acid. So, this will result in the acetylation of the amino group. So, you get finally 4-hydroxyacetaniline. Now, mainly this particular drug is used as an analgesic, so mainly in headache as well as backache, etc. It is also used as an antipyretic, so that antipyretic, as I've already explained, these are the drugs which will reduce the body temperature to the normal temperature, so that if there is any increase in the body temperature, it will be reduced. So it is used as an analgesic as well as antipyretic. Next, we're talking about the synthesis of sulfanilamide from aniline. So the first step here is we take aniline. Now you're going to replace one of the hydrogen of this NH2 group by acetate group. So for that sake, you're taking acetic anhydride. Okay, acetic anhydride. So this step is acetylation. So here you have one of the hydrogen of the NH2. So here there was NH2 group. So one of the hydrogen is replaced by the acetate group. So one hydrogen is replaced by acetate group. So COCH3 and one hydrogen is as such. Okay. Yeah. So in the next step, we are going to add chlorosulfonic acid. So this is chlorosulfonic acid. So you're going to add it so that at the para position, you get this SO2Cl. Okay. So that is nothing but here there was a H group and here there is OH group. So H2O will be removed off so that this SO2Cl group is attached at the para position. Now, here you're going to next step. What we are going to do is we want sulfanilamide, right? So amide group should be there. So we have to replace this chloro group with the NH2 group. So what we have to do? We have to add ammonia so that the one of the chloro group will combine with H so that HCl is removed off. So now the NH2 group will combine with this SO2 to get SO2 NH2 group as the one of the product here at the para position. Okay, so the product, this is unchanged. Okay, at the para position, we have now SO2 NH2, which is nothing but it consists of the sulfanilamide linkage. Final step, we want here at this position, we want the NH2 back. So we have to do the deacetylation. Okay, so during deacetylation by making use of HCl, H2O, that is nothing but acid hydrolysis, you get NH2 back. And of course, here there is the sulfanilamide linkage. Okay. Now, that is the total, whatever you're getting the product, that is nothing but sulfanilamide. Okay. Now, one more thing what you have to understand in this particular process is that here, when we are adding these reagents, especially this reagent, we do not want it to affect the amino group. Okay. It may go and replace the hydrogen of the amino group. So we have to protect the amino group because at the final product, we want the NH2 group as such. We want the NH2 group intact. So that's why we are going to add the acetylation. We are going to do the acetylation of the amino group so that we are going to protect this amino group so that it does not react with the chlorosulfonic acid. Okay. And finally, we are deprotecting this group. This is called as protection and deprotection of the group so that we are going to protect one particular group in an organic reaction from reacting. Okay. Now, what are the roles of this sulfanilamide? What are the uses? It is used in the treatment of urinary tract infections. It is used in the treatment of throat and gum infection. And also, along with other drugs, it is used for treatment of malaria, dysentery, etc. So this was about drugs as well as the classification of drugs and what are the roles of the drugs in each of these classes, and also the synthesis. I've explained about sulfanilamide as well as the synthesis of paracetamol. I hope the concepts are clear. So thank you so much for watching and don't forget to subscribe my channel for more such informative videos. Thank you.